Good afternoon. Thank you for joining us for this month's QTECH committee meeting. We're going to go ahead and get started in just a few more minutes. Thank you. Hello, everyone. Good afternoon. Thank you for joining us for this month's QTECH committee meeting. We'll get started in just a couple more minutes. Hello, everyone. Good afternoon. Thank you for joining us for this month's QTECH committee meeting. We're going to get started in just a few more minutes. On the screen here, you can see our virtual around the room question for today is how has your health center honored Cybersecurity Awareness Month? So please be prepared to unmute or just chime in the chat. I'm sure the committee would love to hear from you all. Thank you. We'll start soon. Hello, good afternoon. Thank you for joining us for this month's QTECH committee meeting. We are about a minute or two after the top of the hour, so give me just 1 second to transition the slides and we can go ahead and get started. Welcome everyone, good afternoon. Thank you for joining us for October's QTECH committee meeting. As we normally do, I'm gonna go ahead and kick us off with some webinar logistics. So just so you know, you have joined the session in a listen-only mode and are muted by default. In order to participate in the interactive Q&A, we ask that using the telephone that you're pinning into the phone line. So that's just something to keep in mind because if not, you might be double muted. You can also use a questions panel during the webinar today to share any questions that you might have for our speakers. And then of course, this session will be recorded for you to revisit after the session, and thank you for participating. As you can see here, we have the list of our amazing QTECH committee members that participate on a monthly basis, where we're all trying to reach our QTECH goals together. So all within the realm of enhancing the patient-provider experience, advancing interoperability, and using data to enhance value. So thank you for joining us. I'm gonna go ahead and just review our agenda with everyone today. We're going to start off our meeting with our welcome and our around the virtual room question, which this month is how has your health center honored Cybersecurity Awareness Month? So maybe things that you've done for this month, or maybe other activities you might have planned for your health center staff. We'd love to hear about it. After that, we're going to transition to our health center spotlight. So we have Crystal Lopez representing Miami Beach Community Health Centers, who's going to be talking to us a little bit more about what their health center has done in preparation for the depression remission measure and some tactics around that. Following that, I'm going to pass the floor to my colleague, Director of CISO Services here at Health Choice Network, Michael Sangili, to talk a little bit more about National Cybersecurity Awareness Month. From there, we're going to go ahead and discuss some takeaways from the virtual educational conference and a link to the recordings should you wish to access them. And then talk a little bit about some preparation for EPIC implementation. And then I'll pass the floor to my colleague, Fred Ira, Practice Transformation Coach, who will talk about some preparing for UDS CQM improvement in 2022. After that, we'll go ahead and do some announcements and a quick wrap up. So without further ado, I have up on the screen the Around the Room virtual question, which is, how has your health center honored Cybersecurity Awareness Month? So feel free to use the chat, unmute your lines if you'd like to say it verbally. We're going to be monitoring both of those for you. So would anyone like to share? Okay, I do see a hand raised. I'm trying to unmute your line at this moment.
Hi, can you hear me?
Yes, yes, we can.
Here we go. This is Blaine Sutliff from Salud para la Gente. One of the items that we did as part of Cybersecurity Awareness Month, and we actually leveraged that as part of the end of third quarter and Cybersecurity Awareness Month, is we renewed our agreement with Phoronix for a product called Deep Freeze. And all of our shared workstations, which we have approximately 80% of our shared fleet, are using a golden image and are frozen. So at the end of the day, they return to a frozen state. So they're always using the same perfect image that's controlled by our IT department, so that if anyone should accidentally store a PDF or any information that has PHI on it on a local workstation, those machines are automatically restored back to that perfect state. No temporary files, no PHI, and no potential for ransomware, malware, that sort of thing, because we do have that centralized control where we can send out a command and restore all the machines or a specific machine to, again, that frozen state, which is controlled. And we update it every week with updates as well as anti-malware systems.
That's fantastic. Thank you for sharing that, Blaine. That sounds like a really amazing application or tool for the workstations for your health center. Would anyone like to also unmute and share what your health center has done for National Cybersecurity Awareness Month? I see some hands raised. Amanda Drescher, can you hear us now?
Hi, can you hear me?
Yes.
Hi, I'm actually Lana Anstey, and I'm the medical clinic manager at Foothills Community Health Center. And we have IT in-house, and what they're doing to help our staff is sending out random emails that actually are tests to see if they fail or pass. And our goal, of course, we have a percentage of, we want in the 90s of who's going to pass, but if you fail, it automatically signs you up for a continuing education on what you failed at, so that you can take this, and then it hits several different topics to help you get more familiar with what you failed at.
That's fantastic. We are very familiar too with those phishing tests, and I could tell you they're definitely one of those things that all of us are hands on deck, like, wait a second, is that real? We need to check. And I'm sure that Mike will share some more insight on those too. So thanks for sharing, Amanda. Would anyone else like to go ahead and unmute their line and talk a little bit more about what they're doing to honor Cybersecurity Awareness Month, or just initiatives around cybersecurity at your health center? I'll give folks a second. Currently don't see hands raised, but again, like I mentioned, feel free to utilize the chat feature. We will be taking a look at that periodically, so feel free to use that to share some other insights with our team. Fantastic. So without further ado, I'd like to pass the floor to our Health Center Spotlight representative, Crystal Lopez from Miami Beach Community Health Centers. So the floor is yours.
Good afternoon, everyone. Thank you, Stephanie. My name is Crystal Lopez. I'm the Vice President of Quality Management at Miami Beach Community Health Center. And today I'll be talking about improving the depression remission measure. Next slide, please. So this is just a quick recap of who we are. We're a federally qualified health center. Obviously, we're a PCMH. We have 3 locations, North Miami, Beverly Press, and Stanley Myers. We have over 70 providers and almost 30 adult medicine providers. Next slide. This is just a quick snapshot of who we serve. In 2020, we served 54,000 individual patients, unduplicated patients, and this is just a breakdown of who they are. Next slide. So depression remission. I'll go over this quickly just because at this point, I'm pretty sure everybody's familiar with how the measure itself works. The measure description is, of course, the percentage of patients aged 12 and up with major depression or dysthymia who reach remission within 12 months, plus or minus 60 days after an index event. An index event being a PHQ-9 score of greater than 9 in the time period that's on the screen under the denominator, and they have to have had at least 1 medical visit during the measurement period. Of course, we include patients with the birth date for this year on or before January 1st, 2009, and patients may be screened using the PHQ-9 or the PHQ-9M up to 7 days prior to their office visit, including the day of the visit. We look at the patients who achieved remission, which is considered a PHQ score of less than 5 within that 10 to 14 month period. And then, of course, we have our exclusions. If the patient has bipolar disorder, personality disorder, emotionally liable schizophrenia, psychotic disorder, or pervasive developmental disorder, they are excluded. And then, of course, patients who have passed, received hospice or palliative care services, or who are permanent nursing home residents are excluded from the denominator as well. Next slide, please. So for us, our strategies center around knowing your data. So if, as many of you have heard before, we've spent a lot of time paying attention to our data and breaking it down in ways that it's a little bit more than the standard dashboard report. In a couple slides, you'll see what we do with our clinical measures table. And then, of course, our strategy around this measure was training, to make sure that the training is provided on a continuous basis to providers and to their support staff. Our clinical trainers are experienced in workflows as they were scribes or MAs themselves before they became clinical trainers. And they actually still provide coverage on the units. They will cover with providers, they will still scribe, and they will still act as MAs occasionally to make sure that they maintain their skill set. I wanted to make sure that whenever they were training, the person that they were training didn't feel a distance between basically that they had a rapport, that they understood what was going on, they understood the difficulties of treating patients and working with providers, and that they were able to provide that training as well. Next slide. So this is our clinical measures table, and it's a little bit small, it's difficult to read. But basically what we do is we break down each measure and we look at where we stand compared to 2020 or the previous year, the state and national averages, and then we break it down at least once a month. We do it more often, but at the very least, we do this table once a month. Depression remission is the very last measure at the bottom. And you'll see that you'll see some colors. So if there's a state and national average, there will be a color in the box. If the box is green, it means that we surpassed both the state and national average. If it's yellow, it means that we surpassed one or the other, the state or the national, but not both. And then if it's in red, it means that we're below the state and national averages. So up until the beginning of about halfway through 2021, we didn't have state and national averages for depression remission because it was a new measure. So that's why the boxes are in blue. And then we moved on to the 9.13 when we were in July. And that's when I kind of decided that we needed to do something about this particular measure. And that's when we started our training program. Next slide, please. So training. Our training was done on a one-to-one basis or in small groups. Nothing bigger than that, because I wanted to make sure that everybody had the opportunity to ask as many questions as possible, and that they felt comfortable. The bigger the group, I've noticed that with trainings, it's a little bit more difficult to get in touch with everybody and really make sure that they understood. We trained both the providers and the support staff. We wanted to make sure that the support staff are the ones that are doing the PHQ-9, of course, but we wanted to make sure that the providers understood why they were doing it in patients that had depression, when previously we had told them that they didn't have to do that because it was an exclusion for the depression measure. Whenever we do trainings, we do attestations, and that's a picture of what our attestation looks like on the right. What we do is we give the person something to sign. It actually gets put into their HR file that they were trained on a particular topic, but it also gives them a statement where they understand, they get a copy of this. They understand that if they have any questions or concerns, that they know who to ask. So they know who they spoke to, they know who they were trained by. So the name of the trainer is at the top, and then the employee receives a copy of this to keep as well. They'll be able to go back and say, okay, well, Daniel from the training department trained me this particular day. I have questions. They know who to go back to. Like I mentioned before, the trainers are clinical staff themselves. So they are familiar with the workflows. They've done this work themselves for years. One of them is a medical doctor and the other one is a medical assistant. They're very persistent. They will train staff as many times as staff requests and as many times as is necessary. And they truly believe in reiterating. So they will explain it in 5 different ways, and they will make sure that the person leaves with a sense of understanding and knows how to ask questions and feels comfortable enough with them to do so. Next slide, please. So these are my clinical trainers. I wanted to give them a little bit of a shout out. So that's Daniel on the left and that's Holda on the right. They are both, like I mentioned, some of the most persistent staff that I have. They take the time to learn anything new. They take the time to make sure that they appeal to the different learning styles of each individual. So the clinical trainers, making sure that you have dedicated staff is really, it's made a big difference for us. And next slide. So that concludes my presentation. I'm not sure if anybody has any questions.
Thank you so much for that, Crystal. I'm going to go ahead and take a look at the box with all of our attendees to check folks that might have their hand raised. And I do see one hand raised, and you should be unmuted. Can you hear us now?
Yes.
Okay, perfect.
Can you hear me?
Yes, we can.
Hi, this is Marty Folsom. I'm calling from Community Health Centers of Pinellas, which is now Evra Health. How do you determine who to screen? Do you screen, what you said that you don't normally screen with the PHQ-9 in the past if they had a history of depression. Do you use the PHQ-9 on every patient? Do you use a PHQ-2? What we're finding is that we normally use a PHQ-2, so when our patients come back, we have trouble determining who needs a PHQ-2 and who needs a PHQ-9. See what I'm saying?
Okay. Yeah, so in our case, we don't use the PHQ-2 at all. So we use a PHQ-9 in every patient. We use, basically what the training entailed was to screen patients that were previously excluded. So before, with depression screening, if the patient had a diagnosis of depression, they were excluded from the measure and they weren't getting PHQ-9s on a regular basis unless the provider really wanted it or something was going on with the patient. So what we trained them to do was to do it at every visit and do it regardless of whether they had that depression diagnosis or not.
Okay, so do you do a PHQ-9 on every patient then?
Yes.
Every visit?
Every visit.
Okay, thank you.
No problem.
That's a fantastic question. Thank you, Marty. So we do have another question within the chat, and I think you touched on this briefly, but how often do you conduct trainings, I guess, in general with clinical staff? Is there like a certain cadence at minimum, and then you, of course, reiterate as needed?
So there's certain trainings that have a particular cadence. For instance, for hypertension and on taking proper blood pressures, we do that every year in December. And it just happened to fall that way because that's when we did the first training and we just did it yearly after that. In terms of new measures, we will train as soon as the new measure, the new measure information comes out or the new strategy comes out or our new presentation is completed. And then we'll repeat it again in a month just to reinforce. And then because they do the trainings one-on-one, they will occasionally get staff that will come back to them and ask questions, and they'll repeat a whole training with them if necessary. but basically it's the one-time training and then a reinforcement within a month or so, and then as needed from that point forward.
That's fantastic. Thank you for sharing, Crystal. I do see another hand raised, and I'm going to unmute your line. And you are currently showing as self-muted.
Unmuted. You talking to me, Stephanie?
I did see a hand raised. Thank you, Allison.
Yeah. I was just wondering, I had noticed that after the PA upgrade, this measure went up substantially. We were at 9% prior to the upgrade and 71% after. And I was wondering if anybody else experiencing this.
For sure. So I'll wait to see if folks will chime in the chat in reference to that. One of the major things that I'm aware of is that PHQ 9 scores of 0 were being counted for remission. So I know that that was a major change that occurred.
Okay, so then that's probably what it is then, because we have a lot of zeros.
Which is fantastic. It's definitely capturing that remission.
So basically, you know, before, I guess you're saying that they were excluded a PHQ of 0?
I think that was an issue that had to be fixed within the dashboards.
Oh.
And
has
yes,
anybody mentioned this to anybody?
I believe we have a communication coming out soon in reference to those specific items. But thank you
But it
for
hasn't come out. It hasn't come out yet.
We'll have to circle back with your question.
Okay.
Thank you for that.
Mm-hmm.
So I see another question within the comments here in reference to something that you already confirmed, Crystal, which was in reference to the PHQ tool you're using at your health center, which is the 9 across the board, regardless if it's for the preventative screening measure or the depression remission measure.
That's correct.
Okay, fantastic. Okay, we have a lot of great questions that came in through the chat and verbally, so just thank you again for your time, Crystal. We really appreciate it.
No problem. Thank you for having me.
Absolutely. I'm going to go ahead now and pass the floor to my colleague, Mike Sangilli, who's the Director of CISO Services, to talk to us a little bit more about National Cybersecurity Awareness Month.
Thank you very much, Stephanie. First, I want to say I'm really happy to hear people are participating in National Cybersecurity Awareness Month. It's great that we're implementing new security controls in the organization and also just spreading the awareness around, whether it be through the phishing tests that we send to the organization, or whether just be spreading general knowledge about cybersecurity to your staff. So that's amazing. Again, we're in healthcare now, so healthcare is the #1 targeted area for hackers. So it's really important for not just the IT teams to know about cybersecurity, but your center staff as well, users, everybody that should know about cybersecurity. So I'll give a quick introduction of myself. My name is Michael Sangilli. I serve as Director of CISO Services, which is essentially our cybersecurity team. And I've been with the organization now for 11 years. And so today we're going to talk about National Cybersecurity Awareness Month. We're going to cover all 4 weeks in this short time period that we have. So we'll run through what the topics are. So week 1 is Be Cybersmart. What they're covering is your personal life cybersecurity controls. So things you can do at home to protect yourself, because not only do hackers target organizations, but they can also target you at home as well. So it's always good to keep yourself organized when it comes to cybersecurity at home and in the workplace. Week 2 is called Fight the Phish. And what that essentially is learning how to identify phishing emails and how to stop phishing threats. That's hackers' #1 ways to attack different organizations. So this is really important for everybody to know how to identify a phishing email and report it. Then week 3 is Explore, Experience, and Share, where they'll discuss cybersecurity awareness culture, how to spread that in your organization, and how to just make everybody aware of cybersecurity. And that also comes with job roles in cybersecurity and how to maybe educate your IT teams on cybersecurity so that everybody can be educated in IT cybersecurity within your IT departments, not just the different areas that are not cybersecurity. And week 4, cybersecurity first, is just general business cybersecurity practices for your organization that we can all learn. So without further ado, let's get started. Next slide, please. So week one is be Cybersmart. So how can you better protect yourself online? These are 4 quick tips. I mean, there's many different things you can do, but these are just 4 very important areas that you should practice at home in your own personal life with your own devices. So secure your networks. Wireless routers are a way for cyber criminals to access online devices. Now, this first tip is, well, maybe it will take you a bit of Googling to try to figure out, but every router at home has a default password. So it's something you could just Google online. So if somebody connects to your Wi-Fi, they can easily log into your router and do different nefarious things on there. Or if somebody were to just get into your Wi-Fi from the outside, maybe some sort of hacker, and you have that default password on your home router, it can leave you open to various attacks. A quick Google search on your router model number or your router model, and just typing in how to change your password on there, your administrator password, will help you fix this in less than 3 minutes, and it'll keep you, that much more safer inside of your home and even in small practices as well. Stay up to date, keeping software updated to the latest versions, set to security software, and run regular scans. So what that's saying is, I know at home we use all of our Windows computers. We always click that skip update button because we don't want to wait there for it to update. So it's just really important to staying up to date with your software, making sure it's always updated, because these companies, like let's say Windows or Apple, they release updates usually to fix security issues within your software. So if you don't fix it, you don't update it, it leaves you vulnerable to hackers being able to take advantage of those vulnerabilities in your network. So when you do see those update buttons, remember that it's usually a security concern. So it's something you do want to update that'll help you protect yourself in case hackers ever come, across you and try to get into your networks. If you connect it, protect it. This is talking about updating your software again, but specifically antivirus software. Something we see very often is people may have antivirus software or anti-malware software on their computers, but it's not updated. So if it's not updated, it's not going to do its job. The reason they update is because new pieces of malware or viruses are created on a daily basis, and these companies get a hold of this information, and then they push out this update to your antivirus software so that it learns how to stop those type of viruses coming in. So if you don't update your antivirus software, and you don't have your antivirus software doesn't have the latest understanding of the latest malware or viruses out there, you can have that antivirus software and still become infected because it's been out of date and it doesn't know how to stop that virus. So always make sure you update your antivirus software as well. You could even take the 1 or 2 minutes it takes to just select automatically update, so that it's just continuously automatically updating itself. Then double your login protection. What this is called multi-factor authentication. Many of us are familiar with it. It just sounds like a very technical name, also known as two-factor authentication. And what that is, it's when you log into, let's say, your bank account, you put in your username and password. It then sends over a text message to your cell phone to confirm that it is indeed you. And the reason for this protection is because, let's say you get phished one day and someone tricks you into giving up your username and password, and they try to log into your bank, they'll still have to somehow access your cell phone to get that two-factor authentication number or that multi-factor authentication number. So if your password is hacked and you do have that enabled, you're still protected. So that's why it's important to enable that, at least on your critical systems, your critical devices that you may have at home or in your personal life. Again, like bank information or anything that you hold close and dear to you that you would never want to be hacked. So always enable multi-factor authentication wherever you can. Next slide, please. So week 2 is fight the phish. We discuss phishing continuously because this is hackers' #1 way to target people. They rarely ever take their time to actually do the technical hacks that you may see on TV, where they pull up cool computer screens and they're doing all this coding stuff. Usually they don't do that. They'll always go ahead and just start with a simple phishing email that they'll create to try and trick you into providing your username and password, or downloading some sort of malicious file, or going to a malicious website. And they do this because if they get your username and password, you don't have that multi-factor authentication enabled, then they can just bypass all the expensive equipment and tools you've bought in your organization to protect you from hackers, and just log straight into your environment and then begin to do different nefarious things around your organization. So it's important to understand how to spot these phishing emails. So this is a quick example you see here that kind of just gives you a layout of what a phishing email would look like. It's always from some legitimate looking email that looks similar to your email or people you do business with. So it may be something, let's say for instance, ours. It may be somebody sending an email from me as Michael Sangili at hcnetwork.org, but it may also just have like two N's in that at area. It may be just misspelled slightly, so it hopes that you don't realize that it's a phishing email. The subjects are always something urgent. The body of the email is always using something called phishing scare tactics, where they're going to send you an email always trying to scare you into acting right in that moment. They don't want you to take a step back and read it again. They want you to click right away what's on the email, and then in hopes that you download that link or provide your username and password. So in this example, it says a vulnerability has been identified in your system. You can be hacked. You need to install some update right away to fix the issue. That's a scare tactic. They're trying to scare you into clicking the link or downloading the software right away, which is usually a virus. So always take a step back, read the email it's coming from, make sure it's legitimately somebody you know, double check that the spelling is 100% correct. And you'll know then at that point, if it's 100% correct, chances are you're safe. But if you see some kind of misspelling in the email, that should be a red flag immediately to delete or report that email over to your IT teams to stop it. Also, if you hover over any links that somebody is trying to get you to click on, it will show you the actual website as you see in the screenshot there. So it says click here, but if you hover over the here, shows you the website you're going to. Let's say they're telling you to go to chase.com. And if you hover over that link, it should say something along the lines of chase.com. If it says something totally different, you know it's misleading you and sending you off to a completely different website, which is usually going to be a phishing website that will look just like chase.com, but will obviously not be chase.com. So always hover over links, and that'll tell you right away if that is a phishing email or a real URL, real website, or if it's something fake. Next slide, please. So week 3 is explore, experience, and share. What they want to do is create cybersecurity awareness culture in your organizations. Again, like I mentioned earlier, it's very important for everybody, not just IT, to understand cybersecurity. So a few things that you can do is conduct continuous phishing exercises in your organization. I recommend doing them monthly. We do them monthly in our organizations, and everybody has become so accustomed to it that they can identify phishing emails right away. We've actually gotten to the point that we have to toughen up our phishing emails and craft them in crafty ways so that we can send them off in hopes they click them, because there's times that we send out many phishing emails and everybody identifies it as a phishing email. So that's great because everybody learns how to identify this. So if a real phishing email comes in, they can stop it in their tracks and they know how to report it to us properly. So also share information regarding cybersecurity to the rest of the organization. It doesn't have to be just about phishing. We share anytime iPhone or Android puts out an update because of some kind of security vulnerability in the phone. We share out that information as well to our organization because it's important for everybody to know. If you do have your own personal devices and they were to get infected, you bring that into your work environment, plug it into the Wi-Fi, and it could spread the virus around the organization. So it's important for everybody to be aware of the latest threats that are out there, just not the IT teams. So also they want to talk about top cybersecurity certifications and how to get into the certification world. So I listed a few cybersecurity certifications that I feel are very important for any IT person in your organization to have under their belt. It's great. It teaches you about many different aspects of cybersecurity. So you could at least plan cybersecurity procedures in your organization, even if you're not, a strict cybersecurity role. So the first one is a CompTIA Security Plus. I always recommend starting with that one first. That gives you the baseline of everything cybersecurity, kind of gives you an overview, teaches you about different types of malware, different types of attacks, and different organizational structures you can put in your organization around cybersecurity. Next one is GIAC Security Essentials Certification, which is a little more advanced, very similar as an overview, but just goes a little more in depth. The one after that is Systems Security Certified Practitioner. And that one is for sort of when you're getting into a cybersecurity management role, teaches you about policies and procedures to implement into your organization so that you can design and develop structure around cybersecurity at a higher level in your organization. And the last one is Certified Ethical Hacker. These are for people who want to get into being the actual good guy hacker, so you can test out your own environment in your own network and see if there's any loopholes or vulnerabilities in your systems that you can take advantage of and then patch it again yourself. Next slide, please. And week 4 is cybersecurity first. So this is general practices for your organization. I could cover this for hours because there's so many things you should do. So these are just the 4 top ones that you should keep in mind of. Again, creating a cybersecurity awareness culture in your organization is extremely important. Like I said, phishing is the #1 attack. So if your organization knows how to identify this, you're going to reduce a great amount of risk when it comes to hacks or threats into your organization. So conduct those phishing exercises and spread that awareness around your organization as well. Number 2 is implement a patch management program. So what this is like I mentioned earlier with your own personal devices, your systems release patches or updates that you want to always patch in a certain time frame. So create some sort of policy around patching if you're in an IT team on if Windows releases an update today, when should I patch this system right away, or should I wait 30 days? You could create, you can understand your own risk. So if you see maybe Windows releases a very severe patch that they say you need to patch this immediately, that's something you can have in your policy that says, okay, so my teams should patch this immediately. So always implement a patch management program. Never let your systems, especially in your organization, fall out of date. Keep track of vulnerabilities and create a plan. Patch management will help you with this because when you patch systems, it will fix vulnerabilities for you. So if you don't have systems patched and you do have vulnerabilities out there, you should conduct vulnerability assessments in your organization in an IT leadership role or for your IT teams so that they can identify what vulnerabilities your systems do have and then create a plan so that they can tackle those vulnerabilities in a timely manner. They're typically listed from vulnerabilities of critical, high, medium, and low. And that'll allow you to have a plan of you tackle the critical ones first, high, and then so forth. So always have a plan on how to attack your vulnerabilities. You will always have vulnerabilities in your network. Everybody does. It's just all about managing them and fixing them as soon as possible because they arise almost on a daily basis. New vulnerabilities come up. So always keep that in mind. And lastly, invest in security. So cybersecurity in the past has been ignored because it was never such a threat. But in today's day and age, as we see on the news almost on a daily basis, a new company is hacked, a new organization is hacked, PHI gets leaked over the internet. So investing in cybersecurity should become a very important part of your budget planning because again, breaches can cost you an average of $7 million a year. That was the data they pulled from the year of 2020. It was an average cost of $7 million a year between hiring forensics teams to fix your issues and track down the issues, to paying penalties and fines, or whatever the case may be. So they can be very costly. It could bring down your organization for days and days, and sometimes organizations go down for even as much as a month because they can't access any of their systems. So always plan around cybersecurity in your budget, make it a big talking topic, and just conduct a risk analysis in your organization so that you can get an idea of what you should be planning for. So those are the 4 weeks. As time goes by, they're going to be releasing more information, but we just wanted to cover those 4 weeks for you and hope that everybody can kind of apply these principles in their personal lives and in their organizations. Next slide. I believe that may have been the last slide.
Yes, that is actually the last slide.
Awesome. Okay. So yeah, we just wanted to spread awareness around this Cybersecurity Awareness Month, the 4 weeks. Hopefully you can use some of this to apply in your organization, pass it over to your IT teams, and just make sure you're staying cyber safe. Other than that, if anybody has any questions, I would love to answer some.
That's fantastic. Thanks, Mike. I'm going to take a look to see if we have any questions within the chat. So far, we have a comment. So someone's saying, thank you, great information that you shared.
Great.
I'm going to take a look again to see if anyone else has their hand raised or has any other further questions for you. I don't see any at this time, so just want to again say thank you, Mike, for being on QTECH and just providing some insight into these key tips and tricks for cybersecurity and keeping organizations safe.
Absolutely. Thank you, everybody.
Awesome, fantastic. So I'm going to go ahead and transition to our next item on the agenda. So what we're going to do today is just go over some really brief high-level takeaways from the virtual educational conference that took place earlier this month. The recordings are available for all sessions, and we highly recommend that if you haven't had a chance just to check those out and listen to them when you have an opportunity to do so. There was a lot of amazing content. For today's meeting, what we're going to do is just cover some of the sessions that tie back to QTECH goals, grants, and objectives for you all. So the first one here was there was a session all in reference to the class Our Collaborative Survey. So in past QTECH committee meetings, we've had an opportunity to have our Chief Clinical Officer, Dr. Tim Long, present some of the findings from that survey that was done in conjunction with 7 different networks. And then taking a look at that data to understand the EHR satisfaction baseline, if you will, for organizations. And of course, getting a better understanding around what defines a successful user of the EMR. So those 3 factors surrounding that: strong user mastery, shared ownership, as well as meeting the unique needs of users as well. So a great session to listen to if you have an opportunity. That ties back actually to our grant goal and objective around provider burden. Here we're looking at some key takeaways from the patient and consumer experience session that took place. So one of the goals for QTECH is looking at patient engagement and patient access to their health information. So there were some key actions that were brought forward in that session around alleviating patient concerns with personalized messages, meeting them at the front door, enhancing some virtual care options, listen through social channels, and of course, exceeding patient expectations. So this was another fantastic session to take a look into. COVID-19 definitely was an inflection point, and patient experience has always been at the source of what's always mattered in terms of experience, but now the stakes have really changed with that, and it's an opportunity to take a look at what tools are out there to help enhance the patient experience overall as well. It's another great session. There was a session also about illuminating the future with analytics. So that was a really interesting session where it talked about, there was a special speaker who spoke to EHR quantity to quality and how it's time to make some changes. So there's some policy impacts to the way that EHR data has been defined and kind of developed in terms of a design, and how that in and of itself has its own challenges in the world of data. So trying to think about how to navigate the normalization and standardized terms for healthcare data to make the data more accessible. And then there was a shout out within that session for the Betsy project and the use of Health Catalyst and kind of the benefits within that tool. So another great session to listen to if you have an opportunity, because one of the goals of the grant is looking at data analysis and just different ways to absorb that information. There was another really good session in reference to creating a culture of innovation, a call to action. So within that section, there was a lot of discussion. It was a panel actually with some great representatives from across different industries, including federally qualified health centers. And there was a great discussion on how to engage patients and thinking about, from the organizational perspective, how to create that culture of innovation to help think about different ideas or providing services in a different manner, or even engaging your patients from different perspectives. So truly a great session to listen to. Of course, those are just some very, very high level takeaways in reference to those sessions, but there are quite a few of other sessions that are available for the recordings that would be of interest. So privacy and security, of course, that was a great session. There's also sessions around the Ask and You Shall Receive, so the Cures Act. I know we've also had presentations in the past for QTECH around that and what that role will really change things on in terms of interoperability and just sharing data and patient access to their data. And then of course, if you have a chance, check out the gallery of success poster presentations. There were a lot of amazing content that was shared from your other fellow colleagues in the federally qualified health center space. And what QI improvements were they working on to help move the needle in some different ways? So totally recommend those. Up on the screen, I just have a QR code for everyone so that you have an opportunity to just scan that, and you can actually access those recordings until next year. So October 12th of next year, that the link will be open for you all to take a look. Fantastic. So the next agenda topic is very brief, but it's in reference to health centers moving through the implementation process for EPIC. One of the things that Dr. Long wanted to make sure that all of you were aware of was making sure that the active problem list and medication list with active items are kept that way within your EMR system. So as you transition from one system to another, having these things be as clean as possible will really help in terms of the transfer of data involved. If you have any other further questions, we'd be more than happy to connect you with the EPIC teams within our organization. Great. So I'm actually going to pass the floor to my colleague, Fred Ira, who's going to talk about some UDS clinical quality improvement tactics. So Fred, the floor is yours.
Thanks, Stephanie. Good afternoon, everyone. My name is Fred Ira, and I am the Practice Transformation Coach here at Health Choice Network. As we come to an end, or we're getting to the end of the 2021 year, and we're looking to wrap up the 2021 UDS and getting ready to report all of the data come February 15th, we need to start thinking and having the conversation about 2022 UDS. So that is the reason for me speaking to you this afternoon. Next slide, please. So we need to start planning now for CQM improvement in 2022. One of the first things you need to do is kind of take a look back at 2021, look at your existing PI plans, PI projects that you had, and kind of see where you are, see if you want to carry those things over into 2022, or if you've reached your goals, then great, and then maybe we can target some other new things. So it's a good idea to take a look at all of your UDS clinical measures and then select the ones that you want to concentrate on for 2022. I will make a side note also as well. Part of the PCMH process, and I know a lot of you on this call are NCQA PCMH recognized. For the annual reporting, we used to have to report on 3 clinical quality measures. For 2022 annual reporting, as I presented in a previous QTECH webinar session, for 2022, we're going to have to report on 5 clinical quality measures. So keep that in mind. And if you start looking at it now and setting up your PI plans for 2022, when it comes time to actually submit the data, it's going to be very easy, as we can just take a lot of the work that you've already done, and then we can go ahead and present that to NCQA. It'll be very easy at that point to present all of the data on your clinical quality measures. Another good thing, or another thing that is important to do, is to review the measure specifications with your staff so that everybody's clear and on the same page on what qualifies the patient for both the denominator and the numerator. Training and retraining of staff on the optimal workflows for these measures is very, very important. As we know, as we've seen in the past couple of years, there have been minor tweaks to workflows along the way that have impacted the quality measures, and it's very important that we train our staff on the proper workflows. Developing your improvement strategies, including input from your staff. The more they know and the more that they're involved in the process, the more they'll care, the more that they'll recognize why we're doing what we're doing, why we ask them to do all of the work that they do, and how it impacts the health center. Plan for regular data collection and review, and share the results with your staff so they can see how their work is reflecting on the whole health center. And be prepared to adjust your strategies if the desired change is not seen. Next slide, please. One of the hot topics that has been on HRSA's scope is diabetes for control. So we recommend to set a goal for HbA1c testing not done during the calendar year. Now that's different from just the diabetes measure, which is looking at poor control. We want to be able to impact, and we want to be able to minimize that number of not done. And you can easily run that report inside of whatever reporting tool that you're using, and consider doing HbA1c tests on all your patients that are diagnosed with diabetes during their first visit of the calendar year, regardless of the due date. Now, why do we say that? Because if you have one of those patients that come in January, February, or the first couple months of the year, they come into your practice and then you never see them. Maybe they weren't doing, you'll be like, oh, we'll get them on the next visit. And then they move on to another practice, or whatever happens. They don't come back to your practice. That's it. They fall into your denominator and you'll never be able to capture that patient. That's why we say that. HbA1c test should be performed and result documented upon entering the diagnosis of diabetes in the patient's charts. Point of care HbA1c machines are a must. I think we've talked about that enough. running your HbA1c poor control reports often, and following up with those patients who are missing the HbA1c testing. So if they don't have a documented A1C, create that list, give it to one of your MAs or one of your staff, and have them call those patients, send out a text message, send them a message to the portal, whatever tools that you have in order to recall those patients back into your practice in order to get that missing A1C. Because if you have a big list of patients who don't have an A1C documented, I guarantee you that your compliance isn't going to be where you want it to be. You bring those patients in, they all get an A1C. I guarantee you some of them will fall into the compliant range. And consider care of the patients with HbA1c poor control, different methods, care coordination, integrating behavioral health, nutrition, some other different types of education and diabetes healthcare, providing more frequent follow-up appointments for these patients, and helping patients with setting self-management goals. Next slide, please. Another hot topic for HRSA has been hypertension blood pressure control. One of the things that we always say here is train, and retraining of the staff on proper blood pressure control taking techniques. There's tons of videos out there. We have included links to some of the videos that we have available on the portal that you can find here and access for your support staff, so they can just review on their skills and kind of refresh that training. Ensuring all providers are aware of the HCN hypertension treatment algorithm. Our providers need some refreshers as well. We provided the link here as well for you if you wanted to share that treatment algorithm with your providers. Consider providing more frequent and follow-up appointments for those uncontrolled hypertensive patients. We recommend, until blood pressure is fully controlled, 2 to 4 week intervals at the most. Helping those patients with setting self-management goals, following up with those patients to encourage adherence. Blood pressure measurements taken by the patients can now be counted for UDS. So that was a recent change that was made. And we provided the link on FAQs here on which devices are allowed to be reported for self-reporting measured BP. Next slide, please. Okay, so clinical quality measures dependent on workflow. There are 4 measures that are strictly dependent on the workflow: pediatric weight assessment and counseling, adult BMI assessment and follow-up, tobacco screening and cessation counseling, and depression screening and follow-up. Now, consider doing these on every visit. If the workflow is hardwired, then the high compliance can easily be achieved. Depression screening and tobacco screenings can be done on a telehealth visit. If doing at every visit is too much of a burden, at a minimum, require doing during the first visit of the calendar year. Same rationale as the A1C. If they come in once and they don't come in the rest of the year, they fall into your denominator, and you'll never get that patient, and you'll never be able to get them compliant. Document the process you decide on and train the staff accordingly. Include the process for routine evaluation of compliance, such as periodic observation by supervisors, chart reviews, and incorporating results of observation and/or chart reviews into staff evaluations. Quick note for the pediatric weight assessment and counseling measure, the patients need to have at least 1 on-site visit. As reported, weight and height is not acceptable for reporting measures. For the adult BMI, they actually made an exception. If they only have a telehealth visit during the reporting period, they will fall out of your denominator, but that is not the case for pediatric weight assessment, so it's very important. Next slide, please. So for the pediatric immunization compliance, consider running the immunization compliance report for your patients turning 1 this year and focus on providing the flu vaccine. The flu vaccine we know is a 2-part vaccine, and it's actually one of the hardest ones in order to get for your kids. And use this opportunity to also check for compliance with other vaccines, especially the rotavirus and the PCV. Checking and double checking the state immunization registry for all non-compliant patients and updating the patient's charts with any vaccine that is in the registry but not in the patient's chart. For the cervical cancer screening, encourage all of your providers to perform Pap screenings. I'm pretty sure all of your providers know how to do a PAP screening, and encourage them to do it on the visits that they come. Avoid requiring them to make a separate visit, because we all know how that works. If they have to make another appointment and then come back, sometimes you'll lose them, and try to capitalize on the opportunity that they're already there at your health center. Empower your support staff to prepare any non-compliant patient who consents for the screening to get it done on that visit. Colorectal cancer screening, providing patient incentives work. See if you can apply for a grant. We've seen some health centers that have applied for grants that offer a $10 gift card, some sort of incentive to the patient that will help them close that gap, close that colorectal cancer screening gap. Work with your local referral providers to increase colonoscopy screenings. Next slide. Some of the CQMs that involve medication therapy, IVD and statin therapy, identifying those non-compliant patients and have the patient's PCP review the record to ensure that that the diagnosis is accurate, review the measurements, the measure specs with the provider staff, and ensure that reported medications are properly documented, and then following up with the patients who need the prescriptions for that particular therapy. HIV linkage to care. Review the record of those patients and the reporting denominator to make sure that they are truly first time ever diagnosed with HIV. A key hint here is if your denominator is really high, you're probably misdocumenting somewhere, and it's really important to do that audit in order to really make sure that your numbers are accurate. Next slide, please. So HRSA has done a bunch of webinars, and they've actually provided a bunch of different webinars for 2021 reporting on different things, on the different tables, on the different the financial tables, different things, the tips on submission and everything. We've provided links here to all of the tapings and actual presentations. They are also located on the HRSA website if you wanted to check those out. We provided the links for you here. Next slide. The last thing I'll talk to you is about the PAL, the Program Assistance Letter for UDS 2022. It actually came out last year, I think in April 2021. And it talks about the proposed changes for 2022 UDS reporting. Now, I provided the link for you here if you wanted to go in and read the PAL yourself, or I've highlighted some of the proposed key changes. Now, these are proposed, these haven't been finalized, and as soon as they are finalized, and the 2022 UDS manual, we at HCN obviously will communicate that to you guys and help you guys get on board with all of the changes that are coming for 2022. Some of those proposed key changes are dropping the dental sealants measure for 2022 reporting, also dropping of the IVD measure for 2022 reporting, and continued alignment with UDS CQMs with the CMS ECQMs. So those are the proposed changes on the PAL for 2022. Thank you.
Awesome. Thank you so much, Fred. We did have some questions in the chat, but we're actually going to take those as a takeaway and just investigate them for you. So we'll get back to you on the questions within the chat. Fantastic. So without further ado, I'm going to go ahead and close us out for this month's QTECH committee meeting. Some key action items for you all. Please submit your health center spotlight if you're interested in having an opportunity with this committee just to share some insights, maybe some leading practices or helpful tips and tricks that you have found in your quality improvement work. You're always welcome to have an opportunity within this meeting to share that insight with everyone. Of course, as we've mentioned in past QTECH committee meetings, there is a grants listserv. So one of the biggest changes that has occurred with HRSA is they're having an opportunity to apply for different funding opportunities through that listserv. So if you don't have it on your email today or your staff that's responsible for that, just make sure that all the appropriate folks have that link and sign up. We do have a upcoming webinar for COVID-19. So I'm going to go ahead and just transition to the slides here for you all. Here's a QR code just for the Health Center Spotlight. Feel free to either use this form or reach out to us directly if you'd be interested in having a Health Center Spotlight within the committee meeting. Here's our QR code for the upcoming COVID-19 session that we have planned. It's all focused around COVID vaccines and targeted populations, specifically kids and expecting moms. So from here, you'll learn more about pediatric vaccinations for COVID, discussing the benefits for expectant mothers, as well as hearing more from school-based health center site roles and how they're promoting the COVID-19 vaccine with the different recommendations. We also have our Clinical Leaders Workshop that's upcoming. Registration will be closing on November 1st, but if you have a chance, please try to register to this event. It's both hybrid, so there's a virtual component or an in-person component. So feel free to register if you haven't had a chance to do so already. A lot of great information for any sort of clinical leaders emerging or seasoned within their roles, just to learn more about different key skills needed within that capacity. And then, of course, as we do every year, the meeting times for November and December tend to fall on around the holidays. So this is just to let you all know that we're actually moving up the meetings. So we'll be having one remaining meeting this year on December 2nd. So you'll be getting more information from the calendar invites, but just be on the lookout for that, and we hope to see you then. Thank you everyone for taking the time to join us for this month's QTECH committee meeting. We hope you have a fantastic rest of your day. Take care.